Welcome back. I am Janice Roundtree. In our previous lessons, we defined biofilm disruption and the head and neck ecosystem. Today, we look upstream at the master driver of that system, the breath. The mouth is the downstream delta of a respiratory river that begins at the nostrils. How a patient moves air through their system determines nearly every downstream condition, from salivary flow to the microbial habitat. Nasal breathing and mouth breathing are not interchangeable routes for the same air. They deliver different gases at different pressures and produce entirely different microbiomes within the oral cavity. Think of the nose as a miniature pharmaceutical plant. Every nasal breath is filtered, warmed, and humidified. Most importantly, it is enriched with nitric oxide, a potent antimicrobial gas produced in the paranasal sinuses. During nasal inhalation, this sinus-produced NO sterilizes the airway and travels into the lungs to regulate vascular tone and blood pressure. Mouth breathers bypass this defense system entirely, seeding their oral cavity with pathogens. There is a paradox here. The mouth-breathing patient gasping for more air is actually getting less oxygen where it counts. Chronic overbreathing exhales CO2 too fast, which is the trigger required to release oxygen into the tissues. We measure this efficiency using the Bolt score, the body oxygen level test. It measures the pause between a normal exhalation and the first definite urge to breathe, giving us a window into the patient's underlying physiology. A Bolt score under 10 seconds indicates chronic overbreathing and high airway reactivity. These patients are almost certainly mouth breathing every night, which reshapes their oral ecology toward acidogenic and anaerobic dominance. You are already looking at these structures every day. Habitual lip parting, low tongue posture, and a high vaulted palate are the clinical fingerprints of a mouth that does not close. They are signs of clear system failure. This is the connection most clinicians miss. Anterior gingival inflammation that does not resolve with excellent home care is not a hygiene problem. It is a humidity problem. No amount of brushing will fix tissue that is drying out every night. As providers, our goal is ecological balance. When we teach patients to breathe through their nose, we do more for their oral and systemic health than any professional cleaning could ever accomplish alone. To summarize, the breath continuously shapes the oral terrain. Sinus nitric oxide is a built-in defense built into the face itself. And remember, look for the humidity problem behind the inflammation. In our next lesson, we'll move from the breath to the living lens, using phase contrast microscopy to observe the ecosystem in real time. I'll see you there.